Hi, everyone, and welcome to the SRHM podcast. My name is Nina Sun, and I'm an associate editor for the SRHM Journal. In this episode, we hear a discussion from an event held on April 17th, 2024, entitled 30 Years of the International Conference on Population and Development, Advancing Sexual and Reproductive Health and Rights in an Era of Challenging Political Contexts. The event was online and was organized by the University of Southern California's Institute on Inequalities and Global Health in partnership with SRHM. The International Conference on Population and Development, or ICPD, set the standard for people-centered development and now, 30 years later, remains the global touchstone for reproductive rights, even as we're seeing massive regressions across all aspects of sexual and reproductive health and rights. In this recording, we hear from an amazing group of panelists who reflect on the history and the future of health and development in the current political moment. We hope you enjoy listening.
I must say, what nice smiles we all have in this picture.
And with that, let me just welcome everybody here. Good morning, good afternoon, good evening, wherever it is that you are. My name is Sofia Gruskin, and I direct the Institute on Inequalities and Global Health at the University of Southern California. And it's my great pleasure to welcome you to today's dialogue, 30 Years of the International Conference on Population and Development, Advancing Sexual and Reproductive Health and Rights in an Era of Challenging Political Contexts. And thank you to Sexual and Reproductive Health Matters for partnering on this event. Particularly, I have to say to Esther Kishmuri for all of your emails, all your communications and work behind the scenes, and to Sapna Desai, my co-moderator, my close colleague, and my dear friend. We started this academic semester by partnering with SRHM on an event on misinformation and disinformation in the sphere of sexual health and sexual rights, which was incredibly important for laying out some key areas of concern. And it feels like only fitting that in this political moment, we end the semester with another joint event, and this one addressing the legacy of the ICPD, a framework that is very much at the center still of the work of both of our institutions. And, Sapna may want to say something on this as well, but I wanted to say a bit about what drove the focus for our event. I think everybody in attendance here would agree that the ICPD is truly recognized to have transformed the global framework for population and development towards rights-affirming policies and programs. And in the past 30 years, there have been tons of positive changes around the world related to sexual and reproductive health and rights, and that major advances have been made with significant impacts on national law and policy, on program development, on service delivery, and on people's lives. But I want to say that it's worth remembering that when ICPD came into being, it was not as bold as many of us had hoped then. It was a consensus document. And certainly from those who are opposed to sexual and reproductive health and rights, it was not uniformly welcomed even then. And the reality of the world we're living in now is that political opposition to sexual and reproductive health and rights has certainly not dissipated over time in any way. And that's alongside a whole bunch of new challenges that we all know, including ideological attacks against gender equality, against sexuality, reproductive freedom and self-determination. And I'm not even talking about nationalism and populism and all of the other things happening in the larger geopolitical space that is our world. And the point I'm trying to make here is that ICPD, for reasons that I think we will discuss, to this day in 2024, remains the touchstone undergirding reproductive and sexual rights in all spheres. And we're fighting to hold the line on something that happened 30 years ago, which many of us thought was inadequate then. And I think personally that is a very sad place for us to be. So my point in saying that is that addressing the issues we care about to strengthen the work in this area has never been more urgent. And I'm incredibly excited about the interdisciplinary and cross-sectoral nature of this dialogue and these people who are with us to really get at these issues. diversity of our panelists is wonderful, but there's so much value in understanding how and why the framework resonates or doesn't from the very different perspectives you each bring. And I'm going to pass it over now to Sapna Desai, my co-moderator, to welcome you all and to give introductions to our panelists. And just to say, Sapna is a public health specialist based in New Delhi, India. She's co-chair of the Board of Sexual and Reproductive Health Matters and a senior fellow at the Population Council Institute, India. Sapna, I'm really happy we get to do this together. So now over to you.
Hello, everyone, and welcome. And thank you so much. And thank you, Sofia, for that intro into the Institute for partnering with SRHM on one of many initiatives together. I just wanted to add, this is also around 30 years of SRHM, of the journal. And I did this exercise of looking back at what's been published, basically since ICPD in the journal. And it's fascinating because you get this immense feeling of progress, of what has changed and what has improved, and also how what we think about when we think about SRHR has expanded so much, not just in terms of topics, but also in the ways we analyze the issues and where evidence has led to action. But as Sofia said, in this kind of sobering time where we do stand 30 years after ICPD, to us as a journal, and I think to all of us as an SRHR community, it bolsters and verifies and strengthens the importance of evidence and continuing to use evidence in the ways that we all do, which is creatively, rigorously, but also ensuring it influences action around SRHR, which is why I'm so excited to have the four of you here today to learn from everyone from different perspectives, but on the importance of where we stand today, and of course, see where all of us as partners continue to work together. So with that, thank you to everyone for being here. I'm going to first start by introducing our panel. So I'm going to start with the panelists in no particular order, but we have with us first Dr. Bushra Asarag, who's a medical doctor and an SRHR activist from Morocco. She's the president of the Association Together for Sexual and Reproductive Health Rights and deputy director of studies in the National School of Public Health in Morocco. She's also coordinator of the Sexual and Reproductive Health Network of North and West Africa, and also the coordinator of our SRHM Francophone African Hub of SRHM, which is very exciting. She currently also coordinates several regional and national studies in North Africa and sub-Saharan countries on SRHR. The next, we have Professor Geeta Sen, who's an honorary distinguished professor of the Ramalinga Swamy Center of Equity and Social Determinants of Health at PHFI, which is the Public Health Foundation of India. She's also an executive committee member of the feminist network DAWN, Development Alternatives with Women for a New Era, which I'm sure most of you know. And she's worked as an advocate, activist, and researcher over many years to promote the ICD paradigm shift towards sexual and reproductive health and rights and gender equality. Amongst her many books, two are very specific to Cairo, and I think particularly, at least affected me as a student, was the Yellow Book, Population Policies Reconsidered. In India, she's a member of many of our governing boards in the government, as well as the high-level expert group on universal health coverage. Next, I'll move on to Dr. Montesser Kamal, who rejoined the International Development Research Center, IDRC, in 2016, having also previously worked there in 2000 for 2 years. He has more than 35 years of experience in international development in civil society, government, and philanthropic sectors. He also led IDRC's Innovating for Maternal and Child Health in Africa initiative. And for 7 years previous to that, he was at the Ford Foundation in the North Africa Regional Office, where he supported research, policy advocacy, and programming around SRHR. And then to our last panelist, we have Uluk Batargaliev, who's an international trainer and consultant on SRHR and a media influencer in Kyrgyzstan. He's a health officer at ECOM, which is the Eurasian Coalition for Health Rights, Gender and Sexual Diversity, and vice chair of the IPPF Board of Trustees, Pleasure Project Fellow, and a CCMGF member in Kyrgyzstan. He's also co-founder of the new generation of human rights defenders of Kyrgyzstan. He has several years of experience in these areas, as well as specific experience in advocacy, human rights, policy briefs, and research as well in training and communication. So welcome, Uluk. So with that, that's our four incredible panelists, as you can see, chosen very specifically to give us a range of views, but also sort of multi-generational views. So I'm going to start with a question to all of you, which you can each answer in a couple of minutes, and I'll go in the same order that I did the intros. So to situate where we are today, can each of you tell us quickly how your work relates to ICPD today? And over the years, when did you first start to see the ICPD framework as relevant to your work, if you do? And how has that changed over time as well? And Bushra, I'm going to start with you.
Thank you, Sapna. I'm very happy. Thank you, Sofia, to invite me to this relevant, interesting panel and about ICPD plus 30 years. Yes, how my work related to ICPD. I began to see the importance of the ICPD framework from the start of my career. As a young woman activist, right, also as a doctor affected in 2000 to a remote rural area in Morocco for 10 years, I noticed the gaps and challenges in the field of sexual and reproductive health. And I realized that the principle of the ICPD offered a solid framework to address these issues holistically, integrating human rights and emphasizing the empowerment of individuals, but the communities remain limited in the field and faces contextual challenges, social, economical, and political, and we will develop this during this discussion for us. However, I think that in front of the new challenges, such as climate change, migration, health crisis, urbanization, digitalization, which have implications for population dynamic and reproductive health, the ICPD's holistic perspective, population and development commitment in human rights and social justice is more relevant than ever. The evolution of my perception over time was influenced by my experience and deepened knowledge I acquired in the field. I think that the ICPD framework is increasingly relevant to guide field activity. I saw how the ICPD recommendation had influenced policies and practice in North Africa and in my country. For the last decade, Morocco increasingly followed the directive of the ICPD framework and has adopted the principle of human rights and respect of gender in its sexual reproductive health planning and monitoring financial monitoring indicators for which it's committed. Our country has made much progress, relevant progress in the various sexual reproductive programs, such family planning with contraceptive prevalence now at 72%, maternal and neonatal health with maternal mortality ratio decreasing from 112 in 2011 to 73 in 2018, and neonatal mortality from 21 to 13. In addition, this framework has contributed to open discussion around inequality in general and gender inequality in my country, moving population concern to rights concern and looking to different social inequality. For example, in our last maternal and neonatal health strategy, 2021, we focused on the poor and rural area and improvement of women and young girls through several initiatives like Human Development Initiative aligned with the ICPD framework and SDGs led by our king, who attached great importance to the health of women, newborn adolescents and youth, and to reduce of inequity in order to do not leave anyone behind. But my reflection about this with the other question that even if we have this progress, we have also several challenges. We will discuss about this. Thank you, Sapna.
Thank you, Bushra. Perfect. You just led into when we'll ask you your next question. Thank you. And I'm going to turn the same question over to Geeta now, please.
Thanks very much, Sapna. So actually, I was looking at the list of participants, and I just want to say hello to all the known friends and unknown friends, maybe, who are also present there. I was trained as an economist, and I converted myself from being a traditional economist, which I was never very happy about, to being a political economist and a feminist economist. So a lot of my work, and I'm talking now about the 1970s and early 80s, was on questions like gender and development, labor, care, though we didn't call it care at that time, etc., and definitely the political economy of the South versus the North. At that time, my concerns around population were largely about top-down draconian population control measures, as well as sterilization abuse, which was a big problem in India, etc. I wasn't really thinking about rights except in that relatively narrow framework. I think as I kept working on these issues by the 1980s and certainly the early 90s, the links between bodily autonomy and integrity on the one side and economic justice and gender equality, between sexual and reproductive health and rights and gender equality, started becoming clearer and clearer to me. A very trenchant example for me, illustration, I should say, for me, was if you think about a woman who is being sexually abused by her supervisor in the workplace, do we put this down to her economic class position as a worker in the capitalist order? Or do we put her abuse down to gender inequality and the system of gender inequality and lack of bodily autonomy and integrity within which we all live? Clearly, these work together. And I think this kind of example and seeing so much of it in different parts of my work made it very clear that it's impossible to talk about economic or social justice without addressing questions of SRHR and of bodily autonomy and integrity. And as far as how that relates to my work today, I guess I could say I was part of the feminist civil society group that birthed the ICPD, so to speak, or helped birth the ICPD. I've lived and breathed it for 3 decades. And the questions related to bodily autonomy and integrity and SRHR spring up automatically. They're like second nature to me right now. Thanks.
Thank you, Geeta. And over to you, Montessor.
Thank you very much, Sapna, and great to be here with everyone. Thank you very much for inviting me. Before I would start, I just would like to acknowledge that the IDRC, where I'm based in Ottawa in Canada, is situated on the unceded territory of the Algonquin Anishinaabe people whose stewardship on the land and waters we now call Ottawa dates back to time immemorial. And this kind of really speaks to the point I want to bring up here, Sapna, which is really was already brought up by Geeta, which is how enlightening it was in ICPD to the focus on rights and the conceptualization of rights and ICPD program of action, how instrumental that has been in for me, for the field, obviously, but also for me in my career. In terms of how we work here, how this ICPD works is connected to our work here in IDRC. As many of you know, IDRC is a Canadian Crown corporation that funds research primarily in low and middle income countries. And how ICPD is reflected in our work is that one of our main pillars of the work that I'm working on and my team is working on is in supporting the research in low and middle income countries to ensure that access to sexual and reproductive health and rights, which is a concept that was squarely embedded in the ICPD program of action 30 years ago, that these rights are fulfilled and the access is achieved. And also, as someone who was at ICPD in Cairo 30 years ago, not from the government side, but from the civil society side, and where I was also doing my fieldwork for my PhD on research on women's health and access to services, sexual and reproductive health services, the concept of reproductive rights, the gender dimensions of sexual and reproductive health, and the importance or the emphasis placed on that for these areas to be improved and to be achieved, that all members and groups of society need to band together to make that work, to make it work for women, girls, people, couples, young people and older people, and make for this all to make sense from a research perspective, from a development practice perspective, and certainly from an advocacy and policy change perspective. And perhaps what has really changed is the momentum. It kind of sometimes feels like the ICPD program of action has kind of like faded a bit in the background, but we certainly had a very strong momentum then, including especially in the region, in the Middle East, the North Africa region where I was based at the time. But we still need to make the case for it, and that ICPD is still as relevant today as ever, and to counter any misperceptions and false truths about it, and which we hopefully will have a chance to speak about in the rest of the webinar. Thanks, Sapna.
Thank you. And lastly, over to Uluk.
Thank you, Sapna. Thank you, Sofia, for inviting, and I'm honored to be here as a young person and also representing the community voices. Greetings to everyone. Good morning, good afternoon, good evening, where you are coming to this webinar. And I wasn't there when ICPD established or stated because I wasn't even born, but I'm here today because the ICPD is connected to my life as a young person, and it's making lots of limitations today as a young person, as a person from the community, as a person who are struggling to access different services in SRHR. I would like to say that my first connection with ICPD was when I was 12 years old, when I was starting my PA education, promoting comprehensive sexual education in a small town in Kyrgyzstan. With Reproductive Health Alliance of Kyrgyzstan, we started this. I joined the work on advocating the access to information, essential and basic information, and then eventually growing as a student, now as a career in ECOM, is a regional-based LGBT umbrella organization for a national organization in Eastern Europe and Central Asia. We are advocating for the rights of LGBT community in our region. We are making sure that human rights, we are making sure that access to the health services are still in going process in this region, and also taking what was the difference, what changed over the time. Having this reflection, I would say the context and the landscape shifted really tremendously, because rising anti-gender movements, rising anti-human rights movements, and anti-body movements really going empowered. And I think these limitations seen over the world, but especially in our region, I could highlight some countries where, for example, having a same-sex marriage is still criminalized, or having an abortion is criminalized, or having a different services as a queer person is still criminalized. So it's so hard today to say that we are going to achieve. And UNFP recently launched the report on ICPD progress, and they're saying that for the 30 years, most ignored population is marginalized communities, marginalized population, women and girls, LGBTI, HIV, and other people who are suffering even more. And I think we are forgetting sometimes about the inclusivity and intersectionality when we are talking about ICPD. Thank you.
Thank you. I'm so grateful to all of you for your responses to this question. And honestly, you're such a fabulous panel, all of you. It's fantastic to have everybody here. I want to start zooming out a bit. And Gita, if you don't mind, you're the key person for this. And I'm really actually grateful to be able to ask you this question directly. What was your hope originally for the ICPD? Was it accomplished? And now, so first of all, kind of what you thought then, but now 30 years passed, and I keep saying 30 years, right? What do you see as the strengths and weaknesses of how the issues were framed then in terms of the ICPD agenda more broadly? And importantly, how is it that it's relevant now?
I get asked this question a lot, and I get therefore to think about it a lot as well. Well, part of this question, there were lots of questions in that one question, Sofia. I think, first of all, it was just a very heady time. It's not like we had a moment to stop and have hopes and pause and think. We were just, going helter-skelter for it. It looked like the opportunity was opening up. The conference was coming up. And we were just thinking, planning on our feet, literally addressing issues as they came up. I think our hopes were, and remember, this ICPD was part of that famous set of conferences, UN conferences of the 1990s. It was a time of great optimism for change. It was a time when human rights were riding high. It was a time when just the year before in Vienna, women's rights had finally been recognized officially as human rights. So it was a time when ICPD was followed the next year by Beijing, by the Commission on Social Development, etc. So it was a very heady time and a lot was going on. So it's a little hard to say, did you hope for X or Y? We hoped for change. We really wanted, if you ask me, I wanted to get rid of this very, very top-down population control approach to thinking about human sexuality and reproduction. We very much wanted the voices of women and those most affected to be the ones making the decisions about policies and funding. We didn't think that UN population conferences should any longer be held once every 10 years with hardly a woman present and all the talk carrying on in a language of numbers as though we were talking about colonies of ants or bees or I don't know what else. Instead of flesh and blood human beings who constitute half of the world's population. So I think that was our hope. And we worked very, very hard for that. And we worked very hard building an evidence base because we knew that without an evidence base, purely an emotional call for change, or even a human rights call for change, which wasn't grounded in evidence, would not take us very far. And I think that the yellow book that Sapna referred to was part of that attempt to build a base of evidence. We very much believed in creating strategies and alliances. And I want to say those like Uluk who weren't born at that time and who might feel that today is a very conflictual and very difficult time. Believe me, we had our share of conflicts. And believe me, we weren't certain we'd be able to pull it off. And so we really had to work hard to give and take and to try and understand across divides, as long as we understood that in the bigger picture of human rights for all and of sexual and reproductive health and rights, we stood together in the context of fair and just economics and of a just development and economic order. If we were on that side, we tried to reach across our distinctions, our divisions, our different experiences, and so on. So building strategic alliances was a very important part of that, as well as working with agencies and governments. We worked with everybody at that time. We argued with them, we agreed with them, we worked more closely with some than with others. And the result, I think, was the result of a huge paradigm change. Now, there were a lot of people who almost immediately, including from my own country, said within 2 years, so what has changed? Nothing has changed. But of course, nothing changes like that. Words and documents give us the frame within which we can think about how policies can change. And that's what the ICPD Program of Action provided. it provided that paradigm change within which we could then think about what policies should be, what programs should be. And of course, it did that as well. The challenges, maybe I can come back to this later, but one of the biggest challenges today that we didn't face at that time was the larger global political and economic environment. It was very, very different at that time. And as I said, it favored, and there was an upsurge of concern around human rights and gender equality in that time. But that, I guess we'll have a chance to come back to that. But I certainly think that ICPD continues relevant today. And I want to echo what Uluk said about the brand new UNFPA State of World Population Report for 2024, which has just come out and which is on inequalities. And I've been calling that paradigm phase 2 because of the focus on inequalities. So let me stop with that.
Thank you, Geeta. And I'm going to turn to Bushra now. And Bushra, in your work, how have you applied the principles of ICPD as you've been working? And what has been straightforward or sort of easier to apply, and what's been equally sort of challenging, particularly in the current context for you?
Thank you, Sapna, and thank you, Geeta. And I agree with most of parts on your intervention. And for our region, over the past 30 years, the International Conference on Population Development had significantly influenced policies and programs, as I said before, related to sexual and reproductive health and rights. The Moroccan government also, because the Moroccan government has become more receptive and sensitive than 30 years before. We have now integrate the values of human rights. And I can give example. In 2030, the Prime Minister has put a circular, like a document, to all sectors. If they didn't integrate the indicators sensitive to gender and human rights, their action plan, they can not give financement to their action plan. And this is very good thing, very good point for us. And also, they produce a lot of evidence. We produce a lot of evidence, and our strategy is based in evidence. In my work in sexual reproductive health and rights, through researches or through training, we apply the principle of ICPD 30 years later can take on several aspects. As I said before, human rights. We integrate human rights principle into all our approach, ensuring that sexual and reproductive health services are accessible to all for free. In Morocco, we have all the services for free in the primary health care, and ensuring respect of the dignity and autonomy individual. In this way, we give several training to decision makers to put them more involved and more conscious about human rights and gender, and in their about strategic planification in sexual reproductive health program and gender-based. And we have only last year in 2023 2 sessions about this training. And we developed the second national strategy of sexual reproductive health, because we have the first one in 2012 to 2021. And the difference of the 2 strategies, that the first one is only about reproductive health and not taking the human rights and gender-based and equality. But this second one, this is sexual reproductive health and human rights and gender-based equality and integration of services. And also, we advocacy and did more advocacy about inclusive policies, because we are convinced that the sexual reproductive health, it's not only the problem of Ministry of Health and Social Protection, but for all sectors. And we have the determinant of sexual reproductive health. And we are in advocacy, continuous advocacy efforts aimed at influence our national policies of sexual and reproductive health, emphasizing the importance of women's empowerment, family planning. But in this way, or family planning, we have some issues, but this family planning is not access to non-married people. And we advocate in this way with this new strategy, because before we have only family women, the public target is married women. But in this new strategy, we put the reproductive health women, 15 to 49, and the fight against harmful practice such earlier marriage. In Morocco now, we have 16% of earlier marriage, but we decreased it. In 2011, we have 23. And in 2019, we have 16%. And more positively, the strategies against infertility. Now we have the priority to have a program against fertility. In Morocco, we have the 12 to 15% couple as infertile. And sexual education. But as I say, there is, however, despite progress, and significant challenge persists, particularly in addressing deeper-rooted economic, as said by Greta, social and cultural norms had hindered the realization of reproductive rights, like taboos surrounding sexual and gender roles continue to impede efforts to expand access to reproductive health services. And these challenges, I can summarize them in social and political opposition, issues related to the sexual and reproductive health. And we can have in minister who is very engaged and committed, but in another government, we have another minister who is less engaged, and we lost a lot of time to implement correctly these values about ICPD. Framework may be politically sensitive or face social, religious, and cultural opposition. For example, I give you example about restriction of abortion, and I can give you some data. We have each year 130 to 160 declared cases of unsafe abortion each year, and are judged in national courts. We therefore observe a dangerous reality which only represents the type, this 130 and 160, only the tip of iceberg. The cases brought to justice have to be added to more numerous cases carried out discreetly or which could lead to death. The problem related to early marriage also we have quality of care. We have a big challenges with the quality of care, communication between providers, parents, and young people, and access to contraception for young people and for adolescents. And we have also challenges about young people, about misinformation and using the wrong one with social media. And in this way, we are conscious of the necessity of decision-based evidence. Therefore, it's important for us to take time and collect public health relevant data around the challenges like unsafe abortion, as said, adolescent pregnancy, quality of care, and to access to services, and how this is linked with maternal and neonatal mortality. We have also perspective to how to eliminate them or achievement progress through comprehensive sexual education and increasing gender equality.
Montasser, I'm going to ask you to lead on this question, but I do want us to be able to hear from a range of panelists on this, if possible. But I'd like to ask you, if you would, to take some space to talk about this. And in the space that you occupy, right, what principles, what issues, concepts do you think from ICPD resonate most in your work? And do you have any concerns about ICPD as the touchstone for guiding health and development policies for the next 30 years? Do you think this is exactly where we need to be? And this question really is for everybody, that this last bit, which is, we're in such a complicated world, and Geeta, I take your point entirely, that it was complicated when we were doing what we were doing back then. There's this additional level of complexity now. And so what is it going to take to keep pushing these issues forward? What approaches, what issues do you see as key to addressing to make sure, at least to the extent possible, that we keep moving forward and that we don't move backwards? And Montasser, may I start with you here?
Sure. Thanks so much, Sofia. I think for many of us that were at ICPD and the lead up to the ICPD 30 years ago, I think many of us wanted to see a world where we had individual suffering doesn't go to waste, so to speak. Girls that were undergoing female genital mutilation, or girls that were forced to get into marriages before the legal age. Many of us felt that at the time that suffering cannot continue, and that we should really be thinking of larger policy change, larger global frameworks to address those issues. And hence, kind of part of what the program of action addressed is through the principles, many principles. And I'm going to highlight here just a few of them that are really, that resonate very much for me, that hopefully also will help keep the momentum going forward for the next 30 and 60 years. And first one is human rights and dignity. There are principles 1, 2, and 3 of the program of action that speak to those in terms of, having reproductive autonomy, access to family planning, access to services, but most of all, really maintaining and upholding human dignity and respecting individual choices and equitable access to services. These were principles that were brought up then, and they continue to be relevant today and for the next decades. The principle 4 on gender equality and empowerment, recognizing that gender equality is not only a moral imperative, but actually a strategic investment, a strategic key, a strategic cornerstone for development and progress. It remains a cornerstone that we see it being violated and not respected. And I think this is a principle that continues to be a priority. The concept principles 7 and 14 that speak about inclusivity, inclusive development and collaboration, or now what we kind of summarize usually as inclusivity, sort of the role of the combined role of government, civil society, and communities and people and representatives of people, including underserved and marginalized populations, to be part of development planning, part of the response to global challenges. We see this as more important than ever now. Now we're living a period compared to 30 years ago where untruths or false truths are at the palm of people's hands through phones and social media. We live in a world where 30 years ago, when the program of action spoke about environment and developed population and environment, the climate change was not so obvious then, or was not so prominent as it is now, and now it is real. Yet the program of action remains very relevant, and those principles remain very relevant. And the principles, for example, 6 and 8 on health and well-being, where population dynamics, health and development are interconnected, and where the responses to those issues require collaboration, not only from the health sector, as colleagues have already mentioned, but also multiple responses from multiple entities. And we've seen that during COVID time, pandemic responses, health emergencies that we see now all the time. In terms of the challenges that we need to address in the upcoming period, they're not necessarily new, but hopefully we have new tools to address them. Regression, the backlash against reproductive rights is now even strong, and even maybe probably stronger than it was 30 years ago. We had a terrible battle during that time, 30 years ago, to really reach the language on reproductive rights and autonomy. That battle is not finished yet, and that space we need to maintain the space and keep the flame going. Another challenge is fadism, fading political will, fading funding, ICPD program of action, the risk of ICPD program of action fading in the background. Hopefully we will all come to realize, or the world will come to realize, that without addressing those challenges and the opportunities and the hopes that were enshrined in the program of action, all of development will be suffering. In terms of maybe one sort of modern, so to speak, kind of challenge is digital areas and innovation, where many have seen progress on leveraging technologies, improving access to health services, data collection, data systems being digitized. Well, but these are two-edged swords if we are not respecting or paying attention to people's rights as well and their autonomy. We have seen situations through research that we're supporting with International Institute of Gender and Health and Global Health and the International Union of Scientific Studies on Population, for example, for work with Uganda and South Africa partners that often underpin the biometric authentication, the biometric authentication and use of artificial intelligence-based algorithms are actually used to discriminate against people, older populations, vulnerable populations, people on the move, ethnic minorities, indigenous communities. They are being discriminated against by authorities using technology to marginalize them even further. I think the way forward, we have to think of collaboration, maintaining a very strong and focused on a human rights lens, but also we need to think of continuing to generate the evidence to build new and better policies that are based on evidence, not ideology only. And as we face the new challenges, we need to really build this evidence and generate the evidence to keep our interventions and programs informed and scientifically based.
Thanks so much, Montessor. And it's interesting to hear the three of you speak about, obviously your different positions. And with that, I want to move to Uluk, specifically given that you are operating in a context where ICPD was, of course, constructed 30 years ago, but you're working with youth. So what resonates from ICPD for you in your work, and what strategies have you used within youth organizing to talk to people about ICPD?
Thank you, Sapna, again for the great question and being in this spot. I think like 2 weeks ago in Benin, we had a global youth dialogue where more than 300 young people all over the world gathered together to discuss SRHR issues and also to discuss what is the ICPD for us, what was in the past, what we are expecting from the future. And I think the collaborative actions, recommendations, what was developed during the Global Youth Dialogue should be implemented by each state, and it should be also be spotlighted by the decision makers. And I think here one of my points about decision making, because young people today, we don't want to be seated in a different chair. We don't want to be seated in an alternative chair. We don't want to be separated to discuss this topic. We want to discuss it here right now with this panel, for example, as an example. And we also want to discuss intergenerational things, how we can learn from what Professor Gita said, how we can learn from their experience on building ICPD agenda today, how we can grow, how we can expect future, and also different approaches. That is why we are talking about young peoples today are more than 1.9 billion. It's a lot. It's a crucial part of the population, and we are still ignoring their needs. We are still ignoring their diversity. We are still ignoring, and we don't want to acknowledge the approaches and ideas that they are giving to us today. Because these politicians, people in power, people in charge, they don't listen. And I read some question why today in family planning, women are taking oral pills, women taking contraceptives, and nothing for men, to regulate fertility and other things. And it's also about question how this was built and constructed in patriarchal world, how heteronormativity is affecting ICPD's progress and how it will affect if we will not change some of our actions and approach today. Young people today coming with a digitalization, using a lot of social media. It's a part of all of us, social media, digital, LinkedIn, etc. How we can ensure how we will use this to effectively address the issues and inequalities and challenges. And I think one of few approaches, what I want to highlight in comprehensive, for example, education, comprehensive sexual education, which are also still not mandatory in a lot of countries. It's a basic needs of well-being, physical changes, reproductive changes is not covered for young people. And this we always talk about when we talk about ICPD or other SRHR issues. We are talking about preventing maternal mortality, preventing SGBV. We are talking about preventing STI, HIV, but we never kind of focus on the sex positivity approach, for example, or pleasure-based approach, for example, when we are encouraging, when we are empowering people to respect their own bodies, to respect their own and different bodies, different by body, I mean like as a human beings. And this is what also Professor Muntasser was saying, the human dignity, the person, the human being is essential and key in this level. And I think building the lots of spaces we want connected to the young people, we don't want something separated. We want to be included in every decision today taking from politicians, from global organizations, from civil society, from the institutions, and still these challenges remaining for today, unfortunately.
Awesome. Thank you to all of you for these responses. I wanted to give a minute to you as a panel to respond to what you've heard from one another. If there's anything that you would like to share now, time is short. But I want to make sure that we get a chance to hear from everybody in terms of what you've heard. And so any of you who have something on the panel, who have something that you'd like to add to what we said, please do raise your hand.
So just wanted, is this our lightning round?
It may end up being so as the way things are moving.
I think, given the time. So let me just say three things which came up as I was listening to Bushra, Muntasser, and Uluk. The first is that I'm a great believer in Sun Tzu's Art of War. And in particular, one of his sayings, he said, never fight the enemy on the enemy's ground. And for me, in terms of my life in advocacy, that has been a very, very important thing. Because the enemy will drag you in the opposition. Let's not use such militaristic language. It's a bad time for that. But the opposition will keep dragging you into where they think you're weakest. But that's not where we should be focused. So I think in as much, for instance, as we are currently facing all this post-truth about gender and anti-gender ideology and all the nonsense that gets put out in that context, in as much as we do have to push back on that, we need to be clear what agendas we're moving forward. Because if we get completely distracted by that, we will be fighting on the grounds of the opposition. That, I believe, would be a huge mistake. Among the things that I think we really need to focus on and move forward is this issue of inequalities. And how is it that we, in fact, address all of the different kinds of inequalities that, in fact, hold back the realization of economic health and social justice for all, that we would be concerned about. And there are inequalities by age, as Uluk said very eloquently, but there are also inequalities on a whole lot of other grounds, as we know. So I think we should really focus on how we move that forward. And the second thing that I would say importantly is what I sometimes now call the elephant in the room, which is that we really must start building, strengthening our alliances and reaching out across divides that may be more apparent sometimes than real. Sometimes they may be real, but even so, I think if we are on the same wavelength in terms of the larger picture of health and human rights, I do believe that it is possible. Not only is it possible, it's extremely important that we reach across what seem to be very vehement battlegrounds at this point among ourselves within our own communities, and make sure that we are in fact able to deal with what we need to do together moving forward. If there is one reason for the success of ICPD more than any other that I would put forward, I would put that one forward. The ability of civil society, the feminist movement, to be at the vanguard of saying, let's build across our disagreements so that we can work for the greater good of all. So I think that that's absolutely crucial for us to do.
That's brilliant. Thank you. And what I'm going to do is ask each of our speakers really quickly if you would add into that before we close the session, if that's okay. Montasser, I see your hand, so you're next. Bushra, you're next. And then Uluk, last word to you before we close. Okay.
Thanks so much, Sofia. I'll be very brief to say I'll build on Geeta's last point. I think one of her last points, which was about the collaboration. The ICPD created the environment and the platform for for collaboration, inclusivity, and interdisciplinary work, multi-sectoral work. We need this more than ever today in a framework of rights and to respond to the climate change problems, the health emergencies, all the many of the problems that we have now are very much connected at the heart of the program of action. We wish we can all collaborate on this even more, and we certainly are trying from our side, but it certainly will take a collective effort to do that, and we'll be counting on the youth to help us sort of navigate and bridge between the previous 30 years and hopefully the next 30 years. So thanks so much, Sophia.
Okay, Sofia, thank you. And in this way, I will continue my reflection about that last point. I think that 30 years ago, when the ICPD was organized, we had more silos between government sector and NGOs and other stakeholders. We have to take opportunities now that we now more than any time to have more multi-sectorial discussion about universal access to sexual reproductive health and how to include sexual reproductive health in minimum initial services package during emergency health and humanitarian crises. During the health crisis like COVID-19 or humanitarian crisis, last earthquake in Morocco, and wars now what we have in the world. To achieve this, I believe that we create a multidimensional approach involving capacity building, more dialogue with stakeholders, with youth also, as said with Uk. I believe that we must find ways to change the social culture and norms by implicating community and have policies based in gender equality, human rights, and continuous advocacy for influencing inclusive policies, sexual reproductive health, and all policies, and adequate research. And I believe that we can be more optimistic for the 10-year future year about ICPD and our work. Thank you.
Thank you. Look, last word from you.
Thank you so much for opportunity to being here, and I would like to reflect on a few things. I think for those who are watching this webinar and also who is in the panel, I would like to call to the action to recognize the diversity of young people and never try to imagine that youth is simple. Youth could be standardized in different approach. So reaching the young people needs a different approach and also should respect the diversity. It's also about inequality, intersectionality. When we are talking about the ICPD, when we want to move the agenda program of action of ICPD in the countries, it should be that each human being, each dignity should be respected. And being different doesn't mean that you shouldn't fit to this world. Being different doesn't mean that you could get punished, or etc., etc. Also, I want to say it's empower young people, build the capacity of young people. And if we have listeners as young people, I really love the phrase what was said during the Global Youth Dialogue. If you are young people and you see that there not a space for you, bring your chair and sit on the table to discuss and take a decision about your life today. And also, I want to give a last point, which were resonating what Dr. Bushra said. It's about humanitarian crisis all over the world. I want to stand in solidarity with the Palestine and people in Gaza who are suffering. Each day, women who are pregnant, dying because of the war. Girls are dying. Lots of things happening, and silence is a crucial thing. What we can as activists do, always talk, always tell to the people and scream if needed and aggressively, advocate, talk about it, push, spread a word, but never be in silence regarding the different issues. Thank you so much.
Thank you so much. And I wish we could go on and on, but first I'd like to just thank our four panelists, Bushra, Montesor, Uluk, and Gita, for your words and really for firing us up to remember, as we wage our own battles from where we all sit, but for the power of alliances, of people like this coming together, the power of evidence, the power of recognizing the diversities, but also, addressing inequalities each in our own way, but also together as we continue on. I mean, I know we will probably be here in 10 years also looking at ICPD plus 40. And I just hope we see the conversation continue to evolve as it has. So on behalf of SRHM and the USC Institute on Inequalities and Global Health, to all of our participants, thank you for being here. And again, thank you all so much for your words and really for the guidance on moving forward. So thank you.
Thank you all. Take good care.
Thank you all.
Thank
Goodbye.
you, everybody.
Thank you.
Bye.
Bye-bye.
Thank you.
Bye.
Bye.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.